An important deadline is right around the corner for rural health care in Kentucky.
Yeah, state leaders are deciding how to spend more than $200 million in federal grant money approved last year by Congress.
Political reporter Isaiah Kim Martinez has this update.
Some are calling it a life-changing opportunity for Kentucky.
Assist people out in the rural areas of the state who are isolated and may not have that specialist in their backyards.
Steve Robertson, executive director of the Kentucky Dental Association, tells me the state is more than 1,300 dental hygienists short. He hopes the more than $200 million federal grant Kentucky now has access to will help change that.
And not have to have those patients wait months and months and travel halfway across the state to get care or to get an opinion.
Thank you, Mr. Chair, for having us here today.
In Frankfort Wednesday, we learned state health officials have fewer than 5 months to figure out how they want to divide up that money to community health groups across the state. The initiative is called the Rural Health Transformation Plan. It's a part of the Make Rural America Healthy Again push. That was established by Congress in President Trump's so-called Big Beautiful Bill last summer.
Decisions have had to be made about how to move quickly.
Health and Family Services Secretary Dr. Stephen Stack testified in front of state lawmakers. He said they'll be investing in community health workers like paramedics, EMTs, doulas, and more.
The explicitly stated goal is over this 5+ year project is to span the whole state, to be widely inclusive, and to try to make sure all of our rural communities are able to benefit from this work to the best of our abilities.
Some of the key areas they're trying to address are diabetes, obesity, maternal health, and dental hygiene across the rural parts of Kentucky. Now, the federal government has given strict guidelines for this initiative. They want systemic changes in the way Kentucky provides care, not simply putting more money into current models. If Kentucky does not abide by these terms, the feds could claw back that money.